Hi, everyone. I hope you guys can hear me. I'm going to assume that you can. I'm Mary Jane Berry, and as listed below, I am a registered nurse. I did work with Social Security Disability for over 20 years, and now currently I am the facilitator and a support group leader for a Parkinson and Movement Disorder group in Georgetown, Texas. So, greetings from Texas. All right. We'll go on and start my slides. This is called Navigating Social Security Disability Insurance. Now, I'm going to share with you, and for those with PSP, kind of a quick way through a compassionate allowance to be found disabled with Social Security disability. However, the information I'm going to provide to you goes and it is applicable to all forms of disability. So, for instance, if perhaps you have a family member who is interested in filing for Social Security disability, this information will also pertain to you. So, with that said, moving right along, my next slide, defining disability. There is a basic definition under the Social Security Act that the only way that you're found disabled is if you cannot do the work that you did prior to the medical condition that you currently have, and that you cannot do any other work, or if your disability has lasted 12 months or is expected to last for this full year or result in death. So this is what we're looking about. And I know my slides are in the Dropbox, and by all means use them. You'll also see that I do have the reference for everything so that you can look that up. Okay, moving right along. The next slide is a process for determining disability. So I'm going to go through how you'll apply for it, but the bottom line is there is a full process for determining if you're even eligible to go on and go forward for disability. And that is, are you working? Now, that means did you earn $1,310 per the month, and are you still working, earning that amount of money? You cannot apply for Social Security disability if you are currently working and making more than this amount. The next thing is your medical condition considered severe. Now, by the severity, again, is looking at it, can you go back to work? Does your disability, is it expected to result in death? Is it expected to result in longer than 12 months? We have, and I say because I had worked there for over 20 years, there is a list of disabling conditions. It's what we refer to as a listing of impairments. There is one for children as well as for adults. So we have to evaluate the disabling condition under these listings. Again, as I noticed before, as I shared, can you do the work that you did before? Can you do any other type of work? But then there is a new thing that came out it's fairly recent, within the last several years. Do you have a compassionate allowance condition? These are a list of conditions that are automatic allowances, very, very quick and very easy. And that is what I will be sharing with you in regards to PSP. Now, when we talk about disability, there's Social Security Disability Insurance, which is SSDI, but then there's also Supplemental Security Income, SSI. These are both federal programs, and they're administered by the Social Security program. However, they are contracted by state, by state, by state. So, for instance, we're here in Texas. We have a whole group, another area that takes all of the Social Security disability claims for Texas, and they evaluate under the SSA, Social Security Administration guidelines for disability. The programs themselves, they don't provide a short-term disability payments. It's where and I'm going to get into it a little bit more about if you are disabled and if it expected to last for 12 months or result in death, there's going to be a waiting period, and I'll talk about that. But it is important to note that certain family members can also get cash benefits under their eligibility criteria, which we'll go through. The Social Security Disability Insurance Program will pay a monthly cash benefit benefit if you are allowed. And again, this is here if you were insured. Now I'm going to talk about that and give you some examples here. That means did you work long enough? Did you work recent enough? Did you pay into Social Security? And the monthly amount is going to be based upon the average lifetime of earnings. Now, it's important to note right here that what I did with Social Security disability in evaluating medical claims is done at a central office, and it's strictly the medical evaluation. The amount of money you get is determined by your local Social Security office. So just about all of your major cities have a Social Security office, and they are the ones that make that determination. They'll do the research on how much money you had paid in. So that group will be doing that one. Who can get Social Security information based upon your work? For instance, if your spouse is 62 years or older and you are found disabled, your spouse is allowed to go on and get a certain percentage of your disability also, but they have to be 62 years or older. That could be a female or the wife or the husband. Your spouse at any age, if they're caring though for a young child, and again, we've got it all specified right here. If it's an unmarried child or an adopted child, even in some situations, but they're younger than 18 years of age. And if they are a young unmarried child, 18 or older, but they have a disability that began before age 22. Those are called childhood disability benefits. So there's a whole lot of things that Social Security has offered in regards to disability benefits. And I want to just share something real quick here. When Social Security first started, it started out as just a retirement way that you put money in through the Depression, and that's when it got started, just giving you a little historical background. But what we found, and what was actually identified more in the early 50s, was that some people were disabled and could no longer work, but they had been paying into the system even at that point. And that's when they came up with the disability insurance. So every one of you who are paying into Social Security, you have this disability insurance that you're paying for and that you didn't realize. And you're not necessarily paying for it. It's a way of getting your retirement benefits earlier if you are disabled. And I'm going to show you the qualifications on what that all entails. So just stay with me here. And as I'm going through, I'm click again to the next one. So it's called the earnings test to see if you qualify for Social Security disability. I'm going to get a little sip of water here. It's based upon your recent work at the time you became disabled, and if the duration of work. And we called it 2040. You may have heard this term before. It is 20, these are quarters out of 40 quarters. In 2021, in order for you to get a credit of quarter, you had to earn $1,470. And that actually would give you 4 credits per year. But you had to have and show that you had earned that much. It doesn't mean that you paid in that much, but that you had that much earnings. Okay, moving right along. So here's a clear way to see it. Most of us, I'm going to jump down to the bottom. If you're 31 years or older, you have at least 20 credits. That means that you worked at least 5 years out of 10 years, making that amount of money that I just shared. Then you are eligible for disability. Now, let's say, for instance, someone is younger, and I'm going to just say, for instance, we have a young man, say, that started working at age 18. He started paying into Social Security, and had been paying in for several years. At age 22, horrible wreck, paralyzed. In that particular case, he had actually worked over 1.5 years and had paid in by paying into Social Security taxes that was taken out of his earnings if he was with a company that took out the Social Security. And it was in 3 years before he became disabled. So he had worked, say, 18, 19, 20, 21, easily 3 years covered. He would be eligible for Social Security disability for the remainder of his life, providing he is still disabled. There is also qualification between 24 and 31 years of age, as you can see here on the slide. But for most of you, and if you have a disabling condition, a PSP, for instance, then the average age is age 60 that it's usually found or diagnosed. You have, and you've worked, if you have worked 5 years out of the last 10 years, you will then be eligible. You will have been insured that you could qualify. Now, if you notice down here below, I've got the date in which your SSID coverage will expire if you are outside of that time period. And I'm going to give you an example here. I'll give you the example of my own mother. My mother had been a hairdresser, had paid in to the Social Security tax and paid in through her earnings all her years. But then at age 40, she went on and retired from that, got married, had a family. At age 60, here she is now. She had a terrible heart disease. Easily was an allowance. I was working for Social Security. I could easily tell that she would be an easy allowance under the listing of impairments that I just mentioned. However, she had not worked those 20 years. Obviously, not in the last 10 years. You have to pay into Social Security 5 years out of the last 10 years prior to your disability. In her case, she was date last insured, which was way back, probably around when she turned 50, and therefore she was not eligible to file even though she had paid into the system. So when you pay into the system, it's Social Security, that your retirement benefits, but you are allowed to have the disability insurance, and you can get your retirement benefits earlier if you're found disabled. And that is this criteria right here that we were just talking about. All right, moving on. Next slide, I've got the waiting period. A lot of people get really confused on this, and they say, why is there a waiting period for Social Security disability insurance? There's a 5-month waiting period from the time your disability starts that they have found that the Social Security Administration found that you were disabled. And you're saying, well, why do they wait 5 months? They do this as part because many people have a short-term insurance, and this is a law that they set up to insure those that have long-term disabilities. So if you have short-term disability with your work, it'll kick in and will cover you up until about that 6-month period. And that is why the Social Security Administration waited and put a 5-month waiting period on it. But I'm going to talk about something very, very important here. If you'll notice down there, I've got AOD versus EOD. AOD is going to be the alleged onset of disability versus the established onset of disability. And I want to go in more detail about that. Because again, this is going to apply if you're filing for PSP, CBD, MSA, or if you have a back impairment and you're filing for disability. This is going to apply, and I want to explain to you why. AOD is your alleged date of onset. In other words, you are alleging that you became disabled on this day. The EOD is what the Social Security Disability Program established as your onset of disability. Now, many times the EOD is going to be the first day that after you stopped working. However, they always fall on the first of the month. So in other words, you may say, I stopped working January the 15th. Social Security disability will go on and say January 15th, but your benefits will not start until February 1st. So one of the things that I do, just as a pro bono now that I've helped folks here, is how to file for Social Security disability. And the key thing is if you could go on and put the first of the month, because even if they found disability as of January the 15th, EOD, it will not start until the first of the month, which would be February. So then your 5-month waiting period will start as of February. So these are just a little things to kind of know. And again, as I've noticed right here, or as I've shared right here in the slide, the SSA will determine the actual EOD. Now, this is another important thing I want to be sure to share with you. If your EOD is before you filed the SSDI, you may receive 12 months retroactive benefits. So let me explain that. We all know with PSP, as well as with Parkinson's disease and so forth, you have a lot of symptoms that appear before you were even diagnosed. You know that there was a lot of things that limited. So let's say, for instance, that you're very symptomatic. You're starting to have some vision problems, some swallowing problems, some disorganization of movement, that sort of thing. And so you quit work, and we'll just say an example, you quit work on March 1st, because it was just, I cannot do it anymore. But you're staying at home, you're trying to do some physical therapy, you've not really been diagnosed, but you just know you're not feeling well. It's not until, say, June 1st that you actually were diagnosed with PSP. In that particular case, you may go on and file for disability, and you may put down June 1st, when in actuality, you stopped working back on March 1st, and you've stopped because of the symptoms. My recommendation, and what I share with people when you're filing for disability, is to go on and put that earlier date back, which would be your alleged onset, which would be March 1st, when you stopped working. Even though you weren't diagnosed at that time period, based upon your history that you gave the physician, when we get the medical records, we could clearly make a presumptive that you were disabled on March 1st, because we know you were. And therefore, your 5-month waiting period will start at that point, and your benefits will be, retroactive to that point if you even filed later. I'm going to give you another example here on this. I had a case that I helped out, and they had pancreatic cancer. Bottom line is, this woman quit work because of all the GI upset and all the problems she was having. She was actually out of work an entire year because she just had so many problems. And she'd been going to the doctor. They kept saying it was colitis, it was this, it was that, but nobody diagnosed it. It was a whole year later, when she was in the hospital, she was finally diagnosed with pancreatic cancer. Now, keep in mind, she had not worked, but in her case, it was a whole year later. So when she filed for disability, she was going to go on and file and basically say, I was diagnosed here with pancreatic cancer. And in her particular case, that's what she did do. She got her allowance the year after, even though she quit work the whole year after. The point I'm going to make is, as we were talking and sharing about this, I said, do you realize you were eligible that whole year before? We were able to submit another application for what we refer to as a reopening and revision, and take her benefits retroactive that full year. So even if you're diagnosed with PSP, MSA, CBD, and you quit work because of the symptoms, but yet you weren't diagnosed until much later, I'm going to encourage you to be sure you put the AOD, your alleged onset of disability, back to the point where you were not working, if you have symptoms that were going on at that time, because it would be to your advantage to get the maximum amount of benefits. So that's what we're talking about here in this slide. And again, the references are at the bottom. Again, this is in a Dropbox, and so you can use this slide to help file for your disability. Okay, next slide. Okay, my thing says attempting to reconnect. So I know that this is being monitored by, let me see if I can go now. Now I can. It connects and disconnects on my moving the slide forward. Okay, qualifying for SSI. The SSI is formally known as the welfare program years back, and then they did not like the welfare benefits, so they supplemented, or they renamed it Supplemental Security Income. But this is, you have to have a very limited income, and you have to have very few resources. The Social Security Disability Program in each state also administers the SSI program, which still follows the same federal guidelines that are put out by SSA. So if you are of lower socioeconomic income and you have few resources, and maybe you never paid into the Social Security Disability Program, you could still be eligible for SSI in your individual state. So that's what this program is about. Okay, next slide. To get SSI, though, you must be 65 or older if you don't have a disability, are totally or partially blind, are a disabled child or adult, again, using those same disability rules and guidelines that were put out to be found disabled, that keeps you from working. Again, the actual same definition of disability applies. And it is nationwide. The basic SSI amount is nationwide, and you can see possibly $794 for an eligible person. And if you are an eligible person, meaning that you are found disabled or you qualified for the 65 and older with eligible spouse, there's a little bit more. Now, I will go on and share with you again and remind you that the amounts of money and the evaluation and research into your work activity is all done by the local Social Security office, and they are the ones that will then put in the amount of money for this. So a lot of what my expertise is in evaluating a disability claim. Moving right along. Okay. In most states, you can get SSI and you may be automatically eligible for Medicaid. And that's pretty much true. That is the advantage. So there's Medicare, the amount of money you'll get in the Medicare insurance, as well as Medicaid if you're eligible for both of them. And in some cases, some people are eligible for both of them, and then they'll figure out who's the payer. But Medicaid is also to your advantage to get, even if you did not pay into the Social Security Disability Program. If you're not eligible for Medicare, this is an insurance program that will help you. And so definitely you'll want to be a part of that. Applying for disability benefits. So it's like, now we kind of talked about where how much money you have to pay in, and the quarters of coverage, as well as if it's low income and resources, if it's SSI. But how do you actually apply for disability benefits? You will do this, and I'm going to highly recommend to do it online. Yes, you can make an appointment and go to your local Social Security office, and that's just fine. But it's very, very easy to do it online. And also I wanted to go on and say at this point in time, so many times you see it on television where a lawyer says, if you've been denied Social Security disability, or if you want to apply for Social Security, come to my law office and do this, which you certainly can do it. Jumping back to what I was going to say, if you see it on TV and you say, well, I'm going to get an attorney to do this, there's nothing wrong with that. You certainly can do that. However, please know that they will definitely take a percentage of the money that you would be eligible for. Now, what I do is pro bono, and there are some legal services that will do it pro bono, but this is where we'll just try to help you out. But it doesn't cost you at all if you can go in a local Social Security office or if you want to apply online. So what you need is your Social Security number, your proof of age, healthcare provider information. That's going to be all your medical sources, medical records if you have them, work history, the W-2 self-employment tax return. And again, all of this stuff, they will ask you online for this information, and they can actually get it online. They can get your earnings report online. They can do that when you go through the online system, or at the local Social Security office, they'll do it. Notice I've got down here, don't wait to apply. Even if you're still gathering all this information, if you are disabled, please go on and apply, because we want to get that date started. Okay, next slide. This is a compassionate allowance, and this is one of the reasons why, too, we want to be sure that you can be expedited, particularly if it's PSP, MSA, Lewy body, CBD, all of these type, ALS, all of these. There's a way to expedite the processing, and the medical condition is called a compassionate allowance. The examples, again, we have down here: inflammatory breast cancer, pancreatic, Huntington's disease. So any of these that we have down here, and I've got the reference again below on this slide so you can see always how to get to all this information that I'm sharing. This is the example of what it looks like. It's called a Program Operation Manual System. POMS is what we call. This is what a disability examiner who evaluates for the medical condition to see if it's disabling has to follow the POMS. And again, myself, for over 20 years, I was at the different levels of a disability examiner. Then I went into trainer, quality assurance, and my last job when I retired was in public relations. So the point I'm going to make is we all have to follow these. Every state has these. These are the Social Security guidelines. And as you can see, this is the specific requirement for progressive supranuclear palsy, PSP, on some of these conditions. What's really good about this nowadays is that this is online. So you can look these up yourself. And if you can get your physician to be sure that he writes this letter with a diagnosis and carries some and has identified some of the common symptoms with it, then this is how we could expedite a case to go right through under a compassionate allowance. The suggested MER is medical evidence of record. That is exactly what MER stands for. The clinical history and examination, as well as the full neurological evaluation, speech and language evaluation, and assessment of swallowing, just as our first speaker just was talking about the swallowing difficulties. So if your physician could easily put this information in medical evidence, meaning the medical records, and that is submitted to the Social Security office, meaning at the local level, they could even do the compassionate allowance and move it right on through. And so that's what you're going to really want to have and be aware of. Again, we've got it down there, how you can visit the local Social Security office, the toll-free number where you can make an appointment online, and then you can actually talk to somebody to walk you through and help you fill out the form. So these are all really, really good. The online disability form is a little bit overwhelming, but at the same time, it's a very step-by-step and easy one to fill out. But always know that you can, again, contact your local Social Security office and they'll help, or if you know someone that will help you out to fill it out. Again, you can use an attorney, but they will take a percentage. The average processing time. Now, let's just go in and talk about if you file for a back impairment, or if you file for you were in a car wreck, or if you file for a cancer, but maybe it was not a cancer that they thought, it was not inflammatory breast cancer. It was just a simple squamous cell. The point is, an average amount of time for a disability claim to be evaluated is anywhere from 3 to 5 months. But the compassionate allowances could usually be done, and checks could actually, depending upon the onset date, be started almost immediately. So you definitely want to review over the compassionate allowance. Again, it's in my slides, the link to find out the whole listing of them. And if you have any questions, feel free, you can ask me and I can tell you after this presentation. The next slide I want to share with you is a disability process. So let's say, for instance, now you have been diagnosed, you want to file for disability, you've gone to your local Social Security office. They are going to, you could do it that way, the in-person, or you can do the online. What happens with your application, either electronically or online, is it will be reviewed. It's reviewed by the local office. The local Social Security office then will make sure that you met all the means requirements, you had enough quarters of coverage and that sort of thing. Then they will process the application and send it to the local, for the state, Disability Determination Division. That's the area where I was in Texas. So each state has their own Disability Determination Division. They get the medical claims or the disability claims. We evaluate it medically. And then a decision is made. Again, the average time is 3 to 5 months, with the exception of a compassionate allowance. They will mail the decision, either an allowance, a denial. But if they do a denial, they will also mail you information on how to appeal. So there is an entire appeal process that you go through if you are denied. Next slide. You'll get a letter from Social Security on your decision. And again, if it is allowed, you will go on and get the letter that'll say the amount, the benefit amount, and the date it'll start. And again, the date of payment will start has a lot to do with when you alleged your onset of disability and when it was established. Remember, there's always a 5-month waiting period. If your application isn't approved, again, it'll be why it was not approved. So they do go on and specify that, and the appeal process on how you can appeal it. The next one is if you do it online, it's really, really good. They'll walk you through on how to set up My Social Security. It's an actual portal. We're all getting into portals with our doctors and so forth. Well, this will be a portal into your Social Security, and it's really, really good because you can find out a lot of information about what's going on. Again, how to set up your direct deposit if you want to do that. If you need replacement Social Security card, anything of that sort. I notice right here, I want to be sure to share the representative payee portal. You can have a representative to help you out if you feel you need that. So keep in mind that is something also that you can set up, not only through this portal, but you can also do it on the application. Anyway, these are just a few of the things here that you can do with the My Social Security, and it's very easy to set it up whenever you do an online process. Next slide will be, again, this is going to be in the Dropbox, all the slides that you can get. All of these are links that will work, plus the 800 numbers on Centers for the Medicare and Medicaid Services, the CMS, the Social Security. And you're saying, well, Mary Jane, what's CMS versus Social Security? Bottom line is Social Security is under CMS. And so they will be evaluating, and it's their guidelines that help us, that we have to follow. The Social Security Disability Determination Division has to follow the guidelines that are put out by Social Security that have been approved by the CMS system. Now, if any of you are in the railroad retirement system, there are some special provisions and some easier access there through Social Security and through Medicare. So I'm going to refer that to the local office, but I do know that they have some special things for them. Again, there's Department of Labor and the State Health Insurance Assistance Program. You do have everybody in each state has different programs that will help out. So all of that is listed for you there. Okay. The next one is there is a handbook, and this handbook is really, really good. In fact, I actually have a copy of the handbook right here. It's called Medicare and You. And if you are on Medicare, everybody is mailed this at the beginning, usually in October, because that's during the enrollment time period. And they'll go on and send it to you, and it is full of information. Pretty much a lot of the stuff that I've covered is all in there, but of course it's, a big old book and hard to find it all sometimes. But anyway, it's a great resource. You can get it online. Again, this link will work for you so that you can get this online. And let's see, that took me off. That is all the way through navigating Social Security disability insurance. I'll be happy to take questions if anybody has any questions for me. And I hope you found this interesting. It really is. We're very, very fortunate to have this option. I know there was people from other countries. I don't know what other countries do, but for sure, we're very, very fortunate that in the United States, we have the Medicare and the Social Security Administration systems. All right. Any questions?
Thank you, Mary Jane. Can you hear me?
Yes, ma'am.
Excellent. This is Joanna Teeters. I'm the Support and Education Manager. It's lovely to have you here with us today. Thank you so much for taking the time to share your experience and knowledge around this complex topic, and it is so important. It's a very popular topic within our community, and we're grateful for you sharing this presentation. We did receive some questions through the registration process and also throughout the course of your presentation today. And for anybody that has other questions that they would like to pose to Mary Jane, please feel free to put them in the chat box per usual. We're going to start here. Let's see. We have a question. If I'm already collecting Social Security, can you also apply for Social Security disability benefits?
Up until the age, this is going to be age related there. If you're 65 years and older, no, because you've already received the maximum amount. If you are 62 years and older and you took early retirement, no. So to answer your question, no. Now, if you are younger than that, let's say, for instance, well, you couldn't get it younger than 62 years of age. So, no. I do know that there are a couple of cases where 62 and they wanted to take the onset farther back. For instance, they found out that they had it was cancer. They took their retirement. There was cancer, and they know they can go back farther. They can go retroactive benefits 12 months, but that would be the only situations. But if you're 65 and older, nope.
All right. Thank you. The next question is, could you describe the wait time for Medicare benefits?
Okay. There's really the wait time for Medicare benefits is the 5-month waiting period. That was put into play whenever they decided to go and let them have or set up the disability system, because many companies, and again, this is people that have paid in, so they're usually thinking they were working for companies, they have short-term disability. A short-term disability will usually go anywhere from 5 to 6 months max. And so beyond me, I mean, this is whoever created all of the disability program, they set it up thinking that those disability benefits would run out. The bottom line is there's that 5-month waiting period, and that's just set in rules. Now, that's why I really want you to set that onset back as far back as possible, because it's possible that you apply for disability benefits, let's say, for instance, in September, but you were diagnosed, or we know we can take the onset all the way back to January. That 5-month waiting period can serve even though you didn't apply till later on. It's dependent upon the established date of disability. Does that make sense?
Yes, it absolutely does. Thank you. I believe we have time for one more question, and this might be more pulling on your experience and knowledge as a support group leader. But we have a question about how to get more assistance in the home health, non-medical caretakers, what insurance and then there's a comment, what insurance or Medicare will or will not cover is so confusing. So alternative resources or just more information about how people can go about getting home health.
Okay. Well, let's say, for instance, that you were allowed Social Security disability benefits and your Medicare has started and you are on Medicare. Now the doctor has decided that they want you to have some follow-up physical therapy and maybe even speech therapy, even occupational therapy. Any of those, they're all they are all definitely paid for, and you are eligible for these through Medicare. And that's going to be through the Part B, which you will have had Part A, Part B, when you were found disabled and you were eligible for Medicare. So let's say you're 50 years of age, so much younger than what you think your retirement benefits would have been at age 65 or 66 in the case now. Most of us are hit that age group. But the whole point is you are now collecting your retirement benefits earlier at age 50, and you're eligible for the check as well as eligible for the Medicare. And by the way, there is I will go on to share with you, there is a waiting period for Medicare. I don't know if that was part of that other question we didn't cover. Medicare doesn't kick in automatically. There is a waiting period for Medicare that is just, again, part of the rules that they set up. I can't really explain to you why they set that delay in time for Medicare, but if you were found disabled at age 50, your Medicare would start at age 52. If you're getting the Medicare, then you, in fact, are eligible for home health services such as physical therapy, occupational therapy. In some cases, there's even different things for some home aid services, but it just is depending on your policy. I mean, the policy, or if you have a supplemental policy that goes along with it. What's not covered is meals delivered to your house, or a 24-hour, home care, anything of that sort, or custodial bathing care. But I know the physical therapy, occupational, speech and language, skilled nursing care, where you can have a nurse come in. Again, all of these have to be, you have to have a doctor that will order it, and then you will go through the company that will be supplying it, and they have to be Medicare eligible companies. So that's one of the things. The other thing, I do want to share with you is you are eligible for DMEs. DMEs are durable medical equipment. Medicare does cover durable medical equipment, again, if it is ordered by the physician, and if you're getting it through a company that is also a Medicare company. But that could include, for those people that are diabetic, it could include their blood sugar requirements, the testing and so forth. It could be commode chairs, crutches, wheelchairs, that sort of thing. So it's to your advantage to file if you paid into the system for Social Security, disability, and then to be eligible for the Medicare, or if you had never paid in, still apply and try to get your SSI, which is your supplemental security insurance, and maybe get some of these covered under Medicaid. All right. Does that kind of help you out?
Thank you so much, Mary Jane. Unfortunately, we don't have any more time for other questions today, but we are so grateful for you for taking the time to be here with us at the CurePSP Family Conference, and for all that you do as a support group leader as well.
All right.
We are going to take a 45-minute lunch break at this point. If you accidentally navigate away from this page, simply click on the link that was sent to your email, and we'll see you back here in 40 minutes at 1:30 p.m. Eastern Time. Thanks so much, Mary Jane, and hope to see you again soon.
Okay. Bye.